DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. And today we're going to discuss West Nile virus in horses. My guest is Dr. Bonnie Rush. She's a professor of equine medicine here at the Veterinary Health Center at Kansas State University. We're sure glad you joined us and I look forward to the show.
We've been using Multimin for about 7 years. It's one of the most multi-use products that we have here on the farm. Bulls, cows, calves, weaning age cattle, just about everything on the place. If they go through the chute, they get a shot of it. The primary use that we started Multimin was in our donor program, in our embryo transplant program. I'd recommend Multimin to any producer in the cattle business. Here at Deer Valley, every animal that goes through the chute gets a dose of Multimin.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold. Bonnie, welcome to the show.
Thank you.
It's great to have you here. Interesting topic today. We're going to talk about West Nile virus. And, you know, for a little bit of background about West Nile virus, you know, what exactly is it?
It's a virus, and it starts, interestingly, with the bird. And the birds have very high levels of virus circulating in their blood, and in some cases that kills the bird, and in other cases the bird doesn't have any signs at all and flies long distances, and a mosquito bites a bird, and then the mosquito bites a horse or a person who are accidental hosts. They don't complete the life cycle, but they can become very ill when the virus enters their bloodstream and then enters their central nervous system.
So the West Nile virus, it starts out, the bird is the host.
The bird is a primary host, and a mosquito is the vector that transmits it from the bird to other mammals that can complete the life cycle, but horses and humans don't complete the life cycle. So they're considered incidental hosts, but they can become very sick. Not everybody that gets bit with a West Nile infected mosquito will become sick. And in humans, about 80% of the people have no clinical signs, and then about 18% of the people will develop fever, and then a small proportion develop these neurologic signs. And in horses, we know that there are horses who get infected and never become ill, and some that develop fever, and the ones that we see are the ones that have developed these very serious, life-threatening neurologic signs.
So with mosquitoes and birds being involved, then we're probably looking at some seasonal...
Absolutely, and it's interesting you should say that. The reason we wanted to present this at this time of year is the peak season. The most cases are in August and September. And you would think as soon as you see mosquitoes, there ought to be a risk. And there's a little bit of risk. There's very small numbers of cases in April or May or June. But for that mosquito to make the most numbers of virus, it has to be warm 24 hours at a time. So the mosquito isn't just a mechanical vector. It just doesn't carry the virus from the bird to the horse. It actually amplifies the virus. So it replicates it millions of times and then puts a huge dose of virus into the horse or the person. And the warmer that it is, and the warmer that it is 24 hours at a time, the more effective the mosquito is at transmitting the disease. So really this is the time. If your horse has not been vaccinated, now is the perfect time to vaccinate your horse, because really August and September is when we're going to see the most cases.
I think it's really, really important to understand that it is seasonal. Get your horses vaccinated, and we're going to talk a little bit more about clinical signs when we come back. We'll have more of a discussion with Dr. Bonnie Rush here, Professor of Equine Medicine. You're watching DocTalk, and we're sure glad that you joined us.
DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
As a manager of grazing beef cows, the thing that's always bothered me about standard trace mineral supplements is that we put them out for the animals to consume, but there's no guarantee that the animals will consume them in the right amounts. Multimin 90 allows us to address at least 3 specific trace mineral issues that we have here in the Flint Hills. Other grassland types here in Kansas, the midgrass prairie in the central part of the state and the shortgrass prairie out west, have their own mineral issues. Multimin 90 matches up with those as well. Trace mineral supplements are also heavy metals, and we have to be careful how we use them, how much we put into animals that might potentially find their way into the human food chain. Multimin 90 is an FDA-regulated product. It's important to follow label directions in terms of dosage and route of administration. The route of administration is subcutaneous, usually in the neck area. There are no risks for injection site lesions, or minimal risks anyway for injection site lesions if used appropriately. What I like as a livestock manager about Multimin 90 is that when I apply that injection, I know that the animal is receiving the 4 critical trace minerals, selenium, copper, manganese, and zinc, at exactly her requirement. I know exactly how much is getting in. In our trial at Kansas State University, we used 460 mature cows. Half of these were injected at preg check time during the month of December, and again about 4 weeks prior to breeding. The other half of the cattle received a saline placebo. We then monitored reproductive performance during a single timed AI event and the subsequent natural service breeding season. In our study, we got 9% greater AI conception on the treated cattle than on the cattle that received placebo, and our calving distribution was shifted farther forward into the spring in the treated cattle as opposed to the untreated cattle.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
There's something wrong. His head is down. He's clearly stressed. He's worried sick about BRD. That's why there's prescription Zactran for BRD treatment and control in high-risk cattle. Get a rapid response plus 10-day treatment and control in a single dose, so you can stop worrying and get back to business. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older, or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been determined. Don't worry yourself sick. Talk to your veterinarian about a real alternative for BRD treatment and control. Because it's critical, it's Zactran from Mariel, a leading animal health company.
America's ranchers and farmers have had a long-standing commitment to quality, and now the Checkoff-funded Beef Quality Assurance Program is working with you to improve our product for consumers. At bqa.org, you'll find an array of educational materials about BQA. You can also take our online course for BQA certification. BQA, it's a commitment to quality, it's a process for continuous improvement, and it's about doing the right thing.
We've been using the Multimin on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using Multimin with the AI conception rate.
Their minerals not up to snuff, you're gonna have problems, and I definitely think Multimin is good for, general healthiness of the cattle.
We think Multimin more than pays for itself.
This segment is brought to you by your Beef Quality Assurance Program, BQA, building consumer trust through your commitment to quality. Learn more at bqa.org.
Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Bonnie Rush, who is a professor of equine medicine here at the Veterinary Health Center at Kansas State University, and we're discussing West Nile virus in horses. And one of the things that, sometimes it seems like it waxes and wanes, and we don't hear a lot about cases, and then we hear a spike in cases. Why might that be happening?
It's interesting you should say that, because a paper from California just demonstrated that based on how long birds live and birds that develop immunity over time will change. And about every 3rd year, there'll be a resurgence of cases, and that cycle will continue. It will never be like it was in 2001, where the disease marched across the country and there were thousands of horses affected, 15,000 horses affected in that year.
Wow.
It will never happen that way again, but what we will see is years in which there are a very light number of cases, and then every 3rd year there should be a resurgence with heavier case numbers.
Okay, well, how do I know if my horse has a West Nile virus?
If your horse has West Nile virus, the signs that you're going to look for are neurologic, and they will start out seemingly overly anxious, and they'll have some head twitching, and they will be overly responsive to light and loud sounds, and then they may develop more serious neurologic signs where they're stumbling, falling, anxious, almost maniacal, and then they'll have these periods of depression. And then after about 24 hours, they become profoundly depressed.
Okay.
Some horses will be unable to rise, and when that happens, the chance that they'll die from this is much greater, about 70% mortality for horses that are unable to rise. If they can stay on their feet, then the survival rate is about 85%. But once they go down, it's really hard to get them to come back. The recovery time is long. It might be 6 to 8 months before they're normal again if they've had a very serious episode where they're stumbling, falling, weak. And the disease that is most commonly confused, the disease that looks most similar to West Nile, is rabies. So it's very important, if you've got a horse that's showing these sorts of signs, maybe even one leg it can't use, and then signs that it maybe doesn't recognize you and is not eating, then both rabies and West Nile can do that. So it's important to sort out very quickly which of these diseases.
Get your veterinarian involved.
Absolutely, yep.
And that's what I was just going to say. When you're looking at those types of clinical signs, you're probably going to want somebody on the farm pretty quick.
Absolutely. And there's a quick diagnostic test that can separate the two diseases to identify West Nile. It's about a 24-hour turnaround test. So
okay, so it's not, is it a blood test? Or?
It's a blood test, yeah.
And so the veterinarian can come out, take the blood sample, and we can know within 24 hours.
Yep.
Incredible. Great information. Thanks for sharing it. We're going to talk more with Dr. Rush after the break about West Nile virus and how to prevent it. You're watching DocTalk, and we're sure glad you joined us.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Be ready for breeding soundness exams with Neogen's new and improved ElectroJack 6. Features a new wireless design, improved waterproofing, and more power for quicker and easier collections. Its newly designed probe features a tapered angle for easier insertion, and new rubberized material adds durability. ElectroJack 6 can be used with rams, boars, and bulls of all sizes. To order or for more information, contact Neogen at 800-621-8829 or your local animal health distributor.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300 LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300 LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300 LA is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Bonnie Rush, who's a professor of equine medicine here at the Veterinary Health Center at Kansas State University. We're discussing West Nile virus. We've discussed what it is and what it looks like when your horse gets it. But now I think the most important part is, okay, we need to prevent this from happening.
That's right. And there are 3 commercially available vaccines. They're all very good. They all have the ability to prevent the disease in 90% of the instances or higher. The vaccination schedule for them is a little bit different. Your veterinarian will know what the vaccination schedule is. Typically in foals, we're talking about 3 vaccines, about 4 to 6 weeks apart. In adult horses that have never been vaccinated before, we're typically talking about 2 vaccines. And the time of year, ideally, that you would vaccinate is before the mosquito season starts.
Sure.
So for us, that means March or April. If you're in a part of the country where it's warm all year and there are mosquitoes all year, then a twice-a-year vaccine would be indicated.
90% high efficacy.
Yes.
For a vaccine.
Really
that's,
high.
That's
Really
really
good.
good technology and good vaccines available. Yeah. And I think understanding that if you give a vaccine for the first time, it doesn't immediately protect the animal. There's some lead time there.
Yep. And so in this time of year, knowing that the peak is in August and September, the time to vaccinate, you really want that vaccine on board before July 15th. You would want to have that vaccine on board.
So when in this type of, if you're looking at different areas, but for the foals, when are we going to start? At what age are they?
Depending on whether the mare was vaccinated or not. In most instances, you're going to start at 4 months of age.
Okay.
The time that most people forget about foals is they didn't vaccinate the first year the foal was born, and the foal was protected by the mare's colostrum.
Right.
And so for us, the cases that we see the most of are those horses in their yearling year. Nobody vaccinated them the first year, but they were okay. Now they're yearlings. That protection from mom is gone, and nobody vaccinated them, and now they're getting sick. So we see horses all ages. Horses over 15 are at risk, but that yearling year is the year that many people forget to vaccinate, and those horses develop clinical signs of disease.
And it makes some sense that
Yes.
they get through that. Anything else on prevention, like mosquito control?
Mosquito control is really important, and we know that horses that live outdoors and live near woods might be bitten as many as 2,000 times in an evening.
Oh my goodness.
And so keeping them indoors, certainly at dusk and dawn, is really important, and trying to control the number of mosquitoes around them with typical repellents work, controlling larval populations in the water by changing out the water buckets or the water tanks once a week will help to reduce the number of flying insects that are there.
2,000 times.
2,000 times. If they're near woods and it's in the evening, they could be bit that many times.
I think I have sometimes I've gone camping. Really great information. When we come back, we're going to discuss more with Dr. Rush and wrap up talking about West Nile disease in horses. You're watching Doc Talk, and we're really glad you joined us. This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
From Kansas State University, this is Agriculture Today. Corn growers can improve their crop management by conducting an in-season assessment of their stands. and that can include running a stock nitrogen analysis. K-State crop nutrient specialist Dave Mingle endorses this approach. He explains what it tells the producer.
Stock nitrate test is run at the tail end of the growing season, just about black layer time. What it is designed to do is to tell us how efficiently we utilize nitrogen. Is there a lot of nitrate left remaining in the stock, indicating we over-fertilized? Is it deficient, indicating we either had nitrogen loss or didn't have enough out there? So that's a good diagnostic tool to use at the tail end of the season to help us think about our nitrogen system.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Bonnie Rush, who's a professor of equine medicine at the Veterinary Health Center at Kansas State University, and we're discussing West Nile virus. And we talked for quite a while about the vaccine in horses. Is there a vaccine available for humans?
Surprisingly, no. We've had an equine vaccine for 10 years, and actually new vaccines have been developed and brought to the market in that time. And there are 3 commercially available vaccines for horses, and there isn't a vaccine for humans available yet. Lots of work has been done to create the ideal safe vaccine for humans, and I hope there's one soon. I would have predicted 10 years ago that we would certainly have one by now, so it's a surprise.
I'll be. You're pretty in tune with research with this virus and equine happenings and on the human side as well. What's going on with research these days with West Nile virus?
I think one of the most interesting questions is, why do some people develop neuroinvasive or neurologic signs? Why do some horses develop it and other horses don't show any clinical signs at all? And we believe that there's some genetic susceptibility to actually developing the disease. And we also know that older horses, 15 years of age and older, and actually light-colored horses, so paints and palominos, are more susceptible to developing the neuroinvasive form of the disease. And men are more likely to get the disease than women, and we're not sure why. The other interesting question is persistent infection, and we don't know about persistent infections in horses, but we know in some humans that there might be virus in your kidney for a very long time, up to 7 years, which would make you less than ideal kidney donor for that matter. That's probably the biggest worry is that sort of donation. And blood donation is also a concern. In the early stages, there's not a lot of virus, but if you get enough virus in a full unit of blood, you're going to get the disease. And so now all of the blood in this country is screened for West Nile to prevent individuals from getting a blood donor associated infection.
Amazing. Well, let's wrap up. What if you're going to have a take-home or a bullet list for our viewers or for the horse owners out there? What would you tell them as kind of the checklist?
It's easy to forget about vaccination because the disease waxes and wanes, and please vaccinate before the mosquito season starts. Recognize that the peak season of seeing this disease is August and September, and so if your horse starts to show neurologic signs that time of year, this disease is one of the more likely ones. Eastern and Western encephalitis too peak at that time of year, and this disease looks most like rabies. Of all the neurologic diseases we see in horses, it's easy to confuse rabies and West Nile.
Thanks so much. You've been a great guest today.
Thank you.
Thank you for watching DocTalk. Remember, always work with your local practitioner, especially when you're seeing neurological signs, such as what we described today with West Nile virus in your horse. If you want to learn more about what Dr. Rush and I do here at the College of Veterinary Medicine, you can go to the web and find us at www.vet.ksu.edu. We sure appreciate you watching. I'm Dr. Dan Thompson from the College of Veterinary Medicine here at Kansas State University. You've been watching DocTalk. We're sure glad you joined us, and we'll see y'all down the road.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Hi there, I'm Dr. Dan Thompson from DocTalk. Join me next week as we're going to discuss lean, finely textured beef with Dr. Randy Phoebus. Dr. Phoebus is a professor here in the Animal Science Industries Department at Kansas State University. We're going to learn the truth behind the headlines about LFTB, find out what it really is, and find out the process that produces it. Join me right here on RFD TV on Mondays at 4:30 p.m. Eastern Standard Time, and I'll see you down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.